limitation. Speaker and the honorable members, on the issue of Edu-Afya, I want to confirm that under the current Social Health Act, the ministry has provided a base cover, and this base cover is comprehensive with a benefit package that covers everyone. We all have to agree that Edu-Afya was specific to students. These students come from families. These students have parents, have guardians. So under the Edu-Afya, all these people are being covered. That it did not make sense to have one small cover just covering the student. We needed to have the parent, we needed to have the guardian covered. And that is why under the Social Health Authority, the cover is for the whole family. It does not discriminate and say, this is for a student, this is for Linda Mama. No, the cover is for Mama, the cover is for the student, the cover is for Baba, the cover is for the whole Jamii. On the third question, which Honorable Sifuna has asked regarding the payment for Nairobi County. Speaker and honorable members, I would like to confirm that as a ministry, it concerns us about all health facilities, public facilities, faith-based facilities, private facilities. All these have to be paid by NHIF. And I want to confirm, Honorable Speaker and honorable members, that NHIF has a process of payment. And the process of payment does not exclude other facilities depending on where it belongs. It is a process that, one, requires that the claim is verified. Whether the claim is from a public facility, a private facility, or a faith-based facility, it has to be verified. Once verified and reconciled, then it goes to payment. So I also want to confirm that, as I had indicated earlier, Honorable Speaker and honorable members, we have had a delay of exchequer. That has given rise to the many huge bills that are being experienced across the country. And I have gone ahead to confirm that indeed we have received confirmation from Treasury that resources are going to be released this week for payment of claims. Honorable Speaker and honorable members, I submit. Thank you.
Senator Mwinyi Haji Mohamed.
Asante Mheshimiwa Spika. Langu ni kumuuliza waziri kwamba kuna malumbukizi ya malipo kwa zahanati na vituo vya afya ambayo yameendelea kwa muda mrefu. Na majibu yake Mheshimiwa Spika hayajaridhisha kwa sababu hajasema pesa zinazodaiwa ni ngapi na zitalipwa vipi. Kwa sababu tumeona wakati NHIF ilipokuwa inafanya kazi, malipo yalikuwa haendi. Na sasa tunatoka kwa NHIF tunakwenda kwa shirika jipya. Tunataka ueleze bunge hili ni mipango gani ambayo umepanga, madeni kwanza ni pesa ngapi, na pili una mipango gani ya kulipa madeni hayo, kwa sababu ukisema tu kwamba yatalipwa, hiyo ni mambo ambayo ni alifu ulela Mheshimiwa Spika. Asante.
Senator Oloba Magoma Gloria.
Thank you, Mr. Speaker. My question is with regards to the government program of Linda Mama. I know that Waziri has clarified that there's a cover that takes care of the whole family. However, under Linda Mama, which was a program initiated under NHIF, issues on maternal health care were actually specified. For instance, complications after birth and things like that. This new cover that you're saying is the alternative of Linda Mama, does it still cater for the specific maternal health care issues that were being taken care of under Linda Mama? As well, if you could also clarify, the Kenya Kwanza government came in we signed a women charter. And under the women charter, we had promised that we will be giving all mothers who have just given birth, that we would give them free sanitary towels, and would also give them 3 months or 6, I'm not quite sure, but I think it's 3 months worth of diapers, free diapers, disposable diapers to their children. this particular issue, which is supposed to be covered as well, I would have thought under Linda Mama, it seems to have disappeared somewhere. Could we get a clarification on that as well? Thank you.
Senator Sosi, and then she will answer those three, and then we go to the statement direct.
Thank you, Mr. Speaker. Mr. Speaker, mine is in relation to the third part of the question. It talks about accountability by the health facilities. While I appreciate the response by the Cabinet Secretary, we'd like to know the list of the health facilities which have been suspended or terminated under NHIF and the reasons of the same. I'm asking this, Mr. Speaker, because I have been made aware that there could have been some discrimination in this process and some unfair practices. And I have a specific case that has been brought to me by my constituent of a hospital by the name Meswo Medical Services, NHIF code number 00131152, where the audit was done in April 2022, and the results of audit indicated that there was no problem. But only a few months later, this hospital has been suspended from NHI. They may...
Faki, sorry, my apologies. Regarding the payment of claims, I want to confirm that the ministry is seized of the figures. The total money owed to NHIF is 30 billion. And out of this 30 billion, Senator, 22 billion is from government institutions. And that is why I stand here confidently saying that, having had the discussion chaired by His Excellency the President, the Ministry of Treasury, and Ministry of Health, there is a plan for release of resources, which I have confirmed that we are going to receive this week. The PS actually got confirmation yesterday of the 8.5 billion. And this money is going to be put to prudent use of payment of claims. Look at that facility to verify what were the issues under that facility, and we shall be able to provide a response to Honorable Osotsi. I submit, Speaker and Honorable Members. On the issue of pads and diapers, I want to agree, Honorable Speaker and Honorable Members, that as a mother, I want to confirm that those two are very, very important. But as it is now, we do not have resources in the budget for those facilities. Push for them, for provision of them. Should there be resources, I want to agree that those are items that should actually be provided. But I also want to confirm that I know that pads are being provided by the Ministry of Gender. So with the diapers, that is something that we can pick up with the ministry and try and get resources to avail them. I submit, Chair.
The Senator Homal Sheikh, you want another clarification because your question you feel was not answered and adequate. And the Chairman held, just wait a bit.
Mr. Speaker, my question is...
End date of the Edu Afia. And the reason why there was an end date, it was actually end of a contract. So it is expected that then the Ministry of Education should have made alternative arrangements. I have had a meeting with my colleague Cabinet Secretary for Education, and we said, should they need the service to be covered for those who are still in India, then they need to write to the ministry so that they give an undertaking of payment of the premium, so that then that can be covered. So far, we have not received a letter of extension from the Ministry of Education. We have not received an undertaking.
Senator Veronica?
I would request you give us a guidance as to whether we are getting a chance to still ask the important questions.
Yes, you ask. You have no problem with
regarding the question she has been answering.
Yeah, so because also senators want to ask the issue on the strike.
Yes.
We are open that you can still ask on NHIF.
Okay.
So there is no problem.
Most, thank you.
So, Honorable CS.
Thank you, Honorable. We are all aware of the ongoing crisis in the case strike notice of intended industrial action, citing failure of both the national and county governments in implementing the 2017 CB. In there, it was adequate, and they proceeded and commenced on the strike on the 13th of March 2024. Following that notice, the Kenyatta National Hospital moved to court seeking stay orders to endanger the lives, safety, and health of Kenyans. The Employment and Labor Relations Court on the 15th of March 2024 ordered that a whole-of-nation approach be instituted towards resolving the instant long-running dispute in Kenya's health sector and for the purpose of achieving a sustainable solution. The ongoing negotiation and conciliation to incorporate the head of public service, the Cabinet Secretary for National Treasury, the Cabinet Secretary for Public Service, the Cabinet Secretary for Labor and Social Protection, the Salaries and Remuneration Commission, to seek to comprehensively address all grievances leading to the strike. As part of the issues that were raised were classified to relate to the national government, while 9 of the issues were classified to relate to the county government. 4 issues fell under concurrent mandates of both the two. The main demand was failure to enhance the risk allowance paid to clinical officers. The union wants the risk allowance to be in 3,000 clinical officers in the country. Only 158 are in the purview of the national government. In the same breath, on the 26th March 2024, the Kenya Union of Medical Laboratory Officers issued a strike notice citing failure by the government to formulate and sign a recognition agreement with the union. The second issue is failure by government to confirm to permanent and pensionable all UHC staff, COVID-19 employees, UHC interns, and National TB and Lung Disease Program Fund employees. The other demands that were raised were all discussed. Impact on healthcare services. This has resulted in unavailability and delayed in help to catastrophic health expenditures and adverse health outcomes for the population. Ultimately, the country stands to lose gains made in key health indicators, including maternal health, HIV, TB, malaria, and NCDs. From our checks, referral facilities, specialized outpatient services are significantly affected at 33% and 25% reduction in specialist and outpatient services. So what has the ministry done in terms of the crisis that is here? I want to confirm that the ministry has categorized this into 3 issues: short-term measures, which we are already working on it, medium-term measures, and long-term measures. In the short-term measures, the ministry has already posted interns in lines with the SRC advisory, 1,207 posting. Posting letters for 1,210 medical officers have been sent to the respective interns, and their names have been published the 15th of March, which is from National Treasury of release of 200 million. So requested SRC to advise on the demand by the Clinical Officers Union to have the risk allowance increase. We understand that this is going to have an impact on the overall budget, and that is why we have requested SRC to give guidelines. Once SRC gives the guidelines, then the ministry will be in a position to work towards implementation. The ministry officers, collaboratory officers have met of health is reviewing the internship policy to address aspects of the program, including the need to transit to internship without any delay. As it is now, what we are experiencing, the interns who have been out, some have been out for more than a year. And this actually delays them from getting the license that they need to practice. So the ministry is working on a policy, and yesterday we finalized internal stakeholders validation. Next week we shall be finalizing on external stakeholder validation, and is to invite the Senate that this is a place that we think that we can benefit from the wisdom of the members during the external stakeholder validation. The ministry is also ready to negotiate on the CBA, that is the new CBA, because the CBA under KMPDU, it lapsed in 2021. But we are aware that from the Ministry of Labour is that once a CBA lapses, until a new one is signed, that is when it comes into effect. On long-term measures, from production, supply, internship, regulation, employment, retention and distribution of stock density, skill mix and motivation, productivity, and general management. The ministry is also in the process of to ensure that the HRH matters are handled permanently. So we seek your support. And Speaker and honorable members, stems from the reason that we now have very many interns. Previously, we only had one university that was training doctors, University of Nairobi. At the moment, the country has 8 universities that is training doctors. Each year, currently we have over 1,000 graduates from the universities. The internshalists have not increased in tandem